1370 WOCA.
Ocala.
Dust my eyes have seen the years, and a slow parade of tears without crying. Now I want to understand. Doctor, my eyes.
All right, 5 minutes after 9 o'clock, Dr. Michael Lange, optometrist Michael Lange, is in the studio. Also, nutrition specialist Dr. Michael Lange is in the studio. Same man, two men in one. It's two doctors in one. He's here to answer your questions about your vitamins, your overall health, and who doesn't want unhealthy overalls, and, of course, your eyesight. And we're going to talk about food for macular degeneration. Good morning, Doctor.
Good morning. It's great to be here, guys.
And the phone number to call, Dr. Lange, right now is the WOCA Climate Control Source Hotline, 622-9622. Just a lot to say before
What an
I say
introduction. We're going to talk about food for macular degeneration. We talk about supplements. We talk about the 4 to 5 vitamins that have developed all the time. But we're going to talk about food that people can start to eat. I've actually got an article, a couple of articles I've written at drmichaellang.com and fortify.com on food for macular degeneration. But before we touch base on that, I want to mention Bausch & Lomb has a brand new product. We're the first in the area to have it, one of the first in Florida. It's a one-day disposable, and it's called BioTrue One-Day Lenses. And it's made of a new generation material called Hypergel. And Hypergel is a material that is a non-silicone polymer. A lot of these new generation contacts are made of silicone, and one of the problems with that is very oxypermeable, which is not a problem, but some of the people don't get the comfort they got with the older hydrogel lenses. So Bausch & Lomb came out with a non-silicone material called Hypergel that stays comfortable all day long. And also, it holds its shape. So it doesn't lose its ability to see clearly, and it doesn't become dry and gritty, and your vision doesn't fog up at the end of the day. So it's an amazing contact lens. I was wearing them the other day. Most comfortable contact I've ever worn. So
really?
If you want the newest, latest in contact lens technology, Bausch & Lomb makes it. It's called BioTrue One-Day Lenses with Hypergel. You can get them exclusively right now through Lange Eye Care and Associates. You know, soon all optometrists and ophthalmologists will have it available. Right now in this area, I think we're the only ones that have it available. Remember, Bausch & Lomb also has a pretty famous lens they came out with last year called Pure Vision 2 HD. That stands for high definition. That's not a daily disposable lens. That's a monthly replacement lens. But for those of you out there that want a lens that's going to improve your night vision, reduce the glare and the halos around cars' headlights at night, Pure Vision 2 HD is the way to go. But if you want the utmost in convenience and comfort, you go with the BioTrue One-Day Disposable.
Really? Robin, that's speaking to you, right?
Yeah. When I get some next time, I'll get those.
Right. We'll have to put you in that BioTrue and see how you like it.
Yeah.
Because I don't want to speak for you, but it seems like, Robin, you get tired eyes like early toward the end of the day, right?
Yeah, I do. They get kind of dry and everything. So
well,
this
that's pretty
will be
common.
good.
You know, the contact starts to dehydrate. Your eyes start to dehydrate. What Bausch & Lomb has done, they have a contact that has 78% water in it. It's a high water content that exactly mimics the cornea. The cornea has approximately 78% water.
Wow.
So what happens is there is no osmosis or diffusion because there is not water going out from a greater concentration to a lesser concentration. And that's usually the way it is with contact lenses. If you have less of a water content or more of a water content, there's this osmosis and diffusion constantly going on. So either the contact lens is drying out or your cornea is drying out, one of the two. So what they've done, it was really fairly ingenious, is made a material that's in harmony with the cornea, the same water content, so it doesn't dehydrate throughout the day.
By the way, I figured out a way, and this has been an issue for us, getting these videos from Ustream directly to YouTube. And I hope it's been helpful for you. We've been putting them on the WOCA YouTube site, and I still don't know enough to know how to tell you to put on Lange Eye Care. But maybe actually Dan has a way, because he did show me a way to do it. So, and that's probably an off-the-air conversation.
Yeah, that'd be interesting, though.
You mentioned something about foods for macular degeneration.
Right.
So I want to hear that, but can you include in there foods that would help other eye conditions, or is it all the same foods?
Absolutely. Food for macular degeneration is going to be good for the entire body. There are some foods that we can add that Well, probably foods for macular degeneration are going to be good for the entire body, because if you have inflammatory conditions in the body, an itis like keratoconjunctivitis, dry eyes, uveitis, iritis, retinitis, things like this, these foods are going to help because they have some very potent antioxidants, so combating against free radical damage, and also anti-inflammatory properties. So one thing, we're going to talk about booze right now. We're going to talk about a little alcohol.
Oh, wow.
Nice.
Wow.
Now remember, everything in moderation, folks. Red wine, but it has to be a specific red wine. It's got to be an organically grown grape, a biodynamic winery, all right? So an organic wine, basically. And it needs to be a Pinot Noir, and it needs to be from the New York region or the Oregon region. It's difficult for me to find a biodynamic winery in New York, so I found them in Oregon.
Okay.
We have those available at our nutrition center in Clearwater. There's one called King's Estate and one called Acrobat that I like that are organic, biodynamic Pinot Noirs. And the reason we talk about Pinot Noir is due to the way that Pinot Noir is actually made, the fermentation process and things of this nature, this particular wine is very high in resveratrol. There's some really exciting studies about resveratrol. Resveratrol has been shown to be a potent antioxidant, a potent anti-inflammatory, but also to exhibit what we call anti-VEGF activity, anti-vascular endothelial growth factor. Remember, in certain types of macular degeneration, we have these little irregular blood vessels that grow into the retina, very fragile blood vessels that start to break down, and then they bleed, and they cause edema and swelling and visual devastation. So if we're eating foods that are high into this anti-VEGF activity, just possibly it will help counteract or help slow down some of the degenerative phases of macular degeneration. Remember, we have injections that we use in our Ocala Lange Eye Care location with Dr. Kaushal, and that is injectable medications like Avastin and Lucentis and Eylea. These are what we call anti-VEGF medications. So now we're talking food. Let's eat foods that have this anti-VEGF activity as well. Green tea, the polyphenols in green tea do exhibit some anti-VEGF activity. So drink an organic green tea and get the green teas that's in the tea leaves, not in the powdered and the bags and the little broken up in bags. So either go to white tea or green tea, both very potent polyphenol content, very potent antioxidant, very potent anti-inflammatory that exhibits anti-VEGF. And on top of that, green tea has another bonus. Green tea actually has a mechanism in it that actually slows down chromosomal aging. The end cap of the chromosome is called the telomere, and it starts to shrink very rapidly as we age. It slows down the shrinkage rate. That's a good thing. Green tea does that. Omega-3 fish oil does that. So also omega-3 has been shown to help macular degeneration. So eat your fish. Eat good fish. Sardines, and the best power fish on the world is what?
The best power fish, Alaskan salmon.
Right? Wild Alaskan salmon.
Wild Alaskan salmon.
Look at that.
Yes.
You can host the show.
Yes.
Yeah.
Wild Alaskan salmon, very high in omega-3, but very high in essential fatty acids, the omega-3 essential fatty acids, and also high in a carotenoid that gives it its orange color called astaxanthin. So astaxanthin also, once again, potent anti-inflammatory. And remember, inflammation is the root cause of many eye problems and many health problems. So astaxanthin is also a very potent antioxidant. It also has been shown to block the blue and the UV light, be a sun absorber, so acting as an internal sunscreen into the retina and the macula. Astaxanthin has been shown to cross the blood-brain barrier and the blood-retinal barrier, so it definitely gets into the retina. So eating wild Alaskan salmon, double whammy, omega-3 and astaxanthin, plus a great source of protein. Now, here's something you have never heard on the radio before. I guarantee it. It's my New Orleans accent. Nobody has ever talked about this on the radio because not many people know this. Especially if you have macular degeneration or there's a family history of macular degeneration. When you cook that salmon, you usually eat the salmon out of the skin and you leave the skin in the bottom there. Eat the skin. All right?
Really?
Eat the skin, especially if there's a family history of macular degeneration, because there is a particular nutrient in the skin called mesozeaxanthin. Remember, astaxanthin is in the fleshy part, but mesozeaxanthin is in the skin of fish and in the fat of turtles. So most of us don't
Okay.
eat turtle fat, but I guess you could have turtle soup, maybe some turtle fats in that, but it's in the skin of fish. So now, wild Alaskan salmon, power food for macular degeneration, threefold now. Astaxanthin, omega-3, and a little mesozeaxanthin that's in the skin of the fish.
All right, two questions. With the speakers are on outside the window, we've got lots of turtles listening right now. So just so they know, they're safe. We're not going to go fishing for them.
Yeah.
And people don't realize it's a very beautiful aquaculture kind of environment out there, kind of a swampy environment for turtles.
The other question, I guess, is, I don't know if this is a good question or not, does the skin taste good? I thought we left it there because we didn't like it. Is there a way to make
I
it?
don't know. I tried eating it the other night, and I wasn't that delicious. I mean, I don't look forward to having skin of fish.
But does it taste like saran wrap or something?
No, you put a little salt and pepper on it and absorb it in there, and it'll be a little tasty.
Salt always fixes everything.
A little sea salt.
But you have to know how to cook it, though.
Right, the best way, what I do is I put it in a pan, I bake it, or saute it, but I always line the pan with organic coconut oil, or in a cast iron pan with coconut oil, and then I put a little lemon on it, and I'll put salt and pepper, and believe it or not, curcumin, or turmeric.
Oh.
And curcumin and turmeric are spices that also exhibit anti-inflammatory and antioxidant properties. And the coconut oil has lauric acid and medium-chain triglycerides that are good for neurodegenerative disorders. And indirectly, I think it's good for macular degeneration. And we can talk about that in a minute.
All right, and you have a phone call, Doctor, and everybody's invited to call if you have a question for Dr. Lange, whether it's about your eyes, your contact lenses, anything associated with your eyes, your vision, or your nutritional needs. The number is 622-WOCA. Good morning. You're on the air with Dr. Lange.
Yes, good morning, Dr. Lange.
Morning.
I have to fight my wife for the skin on the salmon. We put it in a broiler and they make it nice and crisp, and it's a little bit of a war who's there first,
Wow.
But we've been eating the skin on the salmon for years. The question today is, last week, walking in my backyard towards dusk, we were on the dark side net, I ran into a large limb on my tree, just about knocked myself out, but I seen stars and fireworks. Can you explain to me what causes that and what that is?
Yeah, when you have any type of trauma, abrupt trauma to your eye, to your cornea, it's going to kind of shake up the ingredients that are in the eye, the debris that's trapped in there from birth.
Yeah.
All right, there's remnants of something called the hyaloid artery that actually brought nutrients from the optic nerve to the lens,
gosh.
and that artery disintegrates throughout life, but it can't vanish. And so when you hit the eye, any type of impact, a lot of times you're seeing the debris that's been trapped in your eye just kind of shaken up a little bit.
Yeah.
But also you have to be aware that you can sometimes have a torn retina or even a retinal detachment because of the trauma, and then you'll get thousands of little floaters that look kind of like pepper or paprika, and you usually have flashing lights that will accompany that as well. And as a rule of thumb, I recommend getting into your optometrist, ophthalmologist, having your eyes dilated to make sure that you didn't have a torn retina or a small retinal detachment.
Right. Is that kind of like when you rub your eyes real hard, you see that too?
Right, absolutely.
Okay.
And the gist of that story is don't rub your eyes too hard, okay?
Yeah.
Rub them gently, and you shouldn't be rubbing them. If you're rubbing them because they're irritated or itching, you should put a good unpreserved artificial tear in your eye, like Oasis tears, or if you have allergies, you're rubbing them. There's some good over-the-counter preparations, something called Zaditor you can use twice a day, so you don't rub your eyes so they don't itch.
So you can be doing some damage, huh?
Right, if you rub it too hard. If you're rubbing them enough to cause floaters, that's rubbing it too hard.
Yeah. Okay, thank you.
All right, you're welcome.
So he broils the skin, so that makes it sound a little better. It's not mushy. It's just crispy or something.
Right.
Yeah.
That's probably pretty tasty. Kind of like pork rinds, That's the skin of pork, right?
Yeah,
So,
I'm not a fan of that.
we could come out with salmon rinds. We could market it to
I might. That might be better for me. So the question earlier that I wondered about, when we speak about food that's good for the macular degeneration, is it also good for the like diabetes, the caused blindness or eye
diabetic
issues?
retinopathy?
Yeah. Hold on.
Absolutely the same thing, because remember, with diabetes also you have an ischemic retina, an area and a retina that's starved for oxygen. So oftentimes in diabetes you'll also get these irregular blood vessels. It's a little bit different mechanism the way it works, but it's called proliferation or neovascularization. These little irregular blood vessels that grow into your cornea, and once again these are the body's way of trying to bring blood to the hypoxic or starved area for oxygen. But it's not good because these blood vessels break down and then bleed and leak and cause swelling and edema. And once again, we need injections of the same type medication, anti-VEGF medication, Avastin, Lucentis, or Eylea, or we need to laser it with a special laser that we have at the Lange Eye Care locations to stop the leakage, and sometimes a combination of both of those. But with the diabetic, the key here is to control their blood sugar through diet, through exercise, weight loss. Weight management is crucial for these people. So proper food is the same thing with the diabetic as well as the macular degenerative patient. And the same foods that we're talking about. To add to the list of foods, you know, the red wine, once again in moderation, maybe 1 glass at night, no more.
No more.
The wild Alaskan salmon.
No more.
That's my coon-ass accent, right?
No. Wasn't that the name of the wine? The Pinot Noir?
Pinot Noir.
Noir.
Right.
Okay.
Pinot Noir.
No noir than one. No,
spinach, kale, orange bell peppers, and goji berries. Spinach and kale, dark green leafy vegetable. You got to be careful if you're on Coumadin. However, if you're on Coumadin, you can eat the same amount on a daily basis. Then they can regulate the prothrombin time, but you got to talk with your physician about that first. Spinach and kale are high in lutein. Lutein converts into zeaxanthin. It has to be organically grown. Has to be, because remember, it's one of the dirty dozen filled with pesticide, contrary to some of these studies that just came out recently. And also, it has to be cooked, because raw spinach is very high in oxalates. It blocks the absorption of calcium, very acidic, can cause kidney stones. Cooked spinach is a power food, breaks down the cell wall, releases the bioavailability of all the nutrients that are good for you, especially the lutein.
And you have another phone call. Good morning. You're on the air with Dr. Lange.
Good morning, Dr. Lange. I like to watch the PBS channels a lot. I saw a program a while ago. I forget what country it was. I was either South America or India. This woman was supposedly totally blind, and the doctors, that program where they go to these countries and offer their services to help the people over in these countries. The person had this operation, and they were able to restore her eyesight. Now, I thought if it was something like cataracts, if you let them go too far, you can't reverse the cataract. And I was just wondering how that would work with some of these people in other countries that can't get the medical attention until Americans show up. And I'm just wondering if you could explain that, and I'll hang up and listen. Thank you. You have a very good program, and thank you, WOCA.
Thank you.
Thanks for the positive comments. You know, that's a great question, and I got to tell you, cataracts here in America, you know, you can come to Lange Eye Care, we can take your cataracts out. I mean, it's a very simple procedure, not to take anything away from the surgeons, okay, but it is a relatively simple procedure, painless, complication-free in the majority of cases. Now, remember, with any type of surgical procedure, there is always a potential complication. But if you see a surgeon that has done many of them in a good facility using new generation equipment, it is relatively cut and dry, and it works quite well. It's the #1 surgical procedure, most common done surgical procedure in America. But the problem is, when you go to third world countries, they don't have cataract surgeons, you know, in every corner like they do here.
Yeah.
And it's the #1 cause of blindness in many of these third world countries is cataracts. Here, it doesn't cause blindness because they don't have people that are trained to remove these cataracts in enough of an abundance, you know. In India, there's billions of people. China, there's billions of people, so or lots of people, let's put it that way. And a lot of doctors from America go over there, and they do some philanthropic work, and they go and they do cataract surgery. But a cataract gets to the point where it becomes very white and opaque, and you cannot see through it. So many of these patients will ultimately become significantly vision impaired, and some go totally blind because there are complications from the cataract. The cataract actually causes an acute angle glaucoma attack, and it can damage the optic nerve. It can pull on the retina and cause a full-blown retinal detachment. So there's a lot of complications to hypermature cataracts. You got to get that cataract out. So that's a big problem in third world countries. Cataracts, #1 cause of blindness. But also these patients have horrendous amounts of diabetic retinopathy because they're not controlling their diabetes, they're not controlling their high blood pressure, hypertensive retinopathy, macular degeneration, and they also have lots of strange type of parasites that get into their food and into their water system, similar to things like toxoplasmosis and histoplasmosis that we have here in America, where it's these types of organisms that get away and they chew away at your retina and cause visual devastation as well. So luckily, we're blessed to have the greatest medical society here in the United States still, and hopefully next year we'll continue to have the highest quality of medical care, regardless of who the government is.
Yes, I know. We've got 5 more minutes left if you would like to call Dr. Lange. I think we had a call and we lost it. So if that was you or anybody, you're welcome to call back. The number again, 622-9622.
When a person moves from one part of the country to the next, and then the climate is different, do they have to adjust the types of contact lenses they're wearing? Say if you live in Florida and then you move to Arizona?
Yeah, that's a good question. Depending on humidity levels and the dryness, the pollen count in the air, people can have a lot of problems with contact lenses. That's absolutely correct. So if you move to an area that is very high in antigens, near a forest or something, a lot of pollen, then you're going to want to go to a one-day disposable lens. If you go to an environment that's very dry and not very humid, you're going to want to go to a contact like the new Bausch & Lomb BioTrue, which is going to be ideal for almost everybody because if you have high pollen count in the air or very dry environment, the Bausch & Lomb BioTrue lens we started talking about in this program is going to be ideal for those patients.
Oh, okay.
And you have another phone call, Doctor. Good morning. You're on the air with Dr. Lange.
This is Bruce. Listen, I wanted to ask you a question. My right eye has a tendency to water a lot. And it doesn't seem, the left eye doesn't. And yet maybe it's because years and years of using the camera, but it seems clear, but the right eye is clearer. And that confounded water on it keeps getting water on it. I'll hang up and let you explain, okay?
Okay. All right.
All right. A lot of things can cause watering and tearing of the eye. And believe it or not, the number one problem for tearing is dryness. And what happens is the body starts to lose its lubricating properties. The lipid layer and the mucin layer become deficient as we age. Not that you're an old person, but becomes deficient. And your body tries to compensate by crying more of the watery layer. But that watery layer actually further dries the eye out and makes it water even more. It's kind of like if you put a pitcher of water in your motor in your car, that's not the oil, it's not going to work well. You got to put oil in the pistons, all right? And ultimately, the Mobile One is the best oil, one of the best oils. So the Mobile One of the eye, the synthetic oil of the eye, is a product called Oasis Tears Plus. You can get it on the Fortify website, fortify.com. You can get it through your eye doctors. You can't buy it over the counter. You can get it at any Lange Eye Care location. It's called Oasis Tears Plus. So try a good lubricant. That's the one I recommend. Or buy one over the counter like Refresh Tears. And use that when your eyes start to tear. Put the lubricant in your eye and see if it helps. If that doesn't help, it could be something else. You could have a microcilia or an eyelash that's turning in, rubbing against your cornea. That's called trichiasis, stimulating reflex tearing. You could have a little bit of a prescription that's not corrected, like a little farsightis or a little astigmatism, causing a little eye strain that could cause some tearing. And there's a whole host of other things that can cause tearing as well. You could actually have a blocked duct. There's a little gland called the punctum in the lower and upper lid margins. Sometimes these can become blocked, and if they become blocked, then you get profuse tearing because your tears aren't draining out as well. So there's a whole host of things that it ultimately could be, and I'd suggest getting into your local optometrist or ophthalmologist. Certainly come see me or any of the doctors at Lange Eye Care. We should be able to determine the problem and treat it appropriately. It doesn't sound like it's serious.
Now, I don't know if you picked up on it, but he's a professional photographer. So would that have possibly caused one eye to be a different circumstance than the other? If he's,
Well, I see a lot of photographers that have had chronic use, your eye up against the ocular, and it's caused the eyelid to actually deform a little bit and cause it to turn in, causing entropion or this trichiasis. So, yes, it very well could be a correlation to being a photographer, but that's still something we should be able to treat fairly easily.
I hope so. Well, before we wrap it up, one question I had about fish oil and eating fish. Would you still need to take the fish oil if you have a lot of fish in your diet? diet.
No, you wouldn't. That might be overkill. If you're eating wild Alaskan salmon or eating sardines, those two fish, you probably don't need to be taking an omega-3 fish oil if you're eating a large enough portion.
Right,
all right?
okay.
But so that's like me. Like last night I had wild Alaskan salmon, so I didn't take my fish oil last night. Today I'm going to have some grass-fed beef and some organic chicken. I'll be taking the fish oil today.
I got you.
So it all depends on your diet. And then we got to add orange bell peppers and goji berries to the food for macular degeneration. Orange bell peppers and goji berries are very high in zeaxanthin, another carotenoid good for retinal health.
Always a good show, Dr. Lange. Just never enough time. There's always so many more questions we have. Before you say goodbye, how was your trip to Vegas?
Oh, it was great. I was at the Vision Expo West. It was a lot of interesting doctors I've met. Talked about nutrition to doctors from all over the world. So it's one of the largest conferences in the world for eye doctors, ophthalmologists, and optometrists. It was a lot of fun.
Wow. Next time we have a radio convention, I want to go to. We can't have it in Vegas. Usually we have it in Joe's office, but thank you, Dr. Lange. What is your phone number?
237-3768. That's 237-3768, or go to langeeyecare.com.
Excellent. We'll take a little break and be right back. Thank you, Dr. Lange.
Ocala's information station, 1370 WOCA.
Ocala.
The weather is brought to you by myfwc.com. Life jackets save lives. Wear it, Florida. Partly sunny today and rather breezy. There can be a passing shower at any